Hi, everybody. My name is Tamara Bucca. I'm the Public Awareness and Communication Lead with the Arizona Oral Health Coalition. I will be interviewing somebody very amazing today. Her name is Kate Dobler, and she's one of our members for the coalition. Recently, she received an award from Phoenix Magazine to be named one of the 2025 Healthcare Heroes. Kate is a state opioid treatment authority for access and is very passionate about her work and a true advocate for substance abuse disorder. From this point forward, I'm going to go ahead and let Kate talk about herself.
Thanks, Tammy. I gotta say, this is kind of cool to be on. It feels like a podcast. It's on your little YouTube video here talking about sort of the work that I do within the opioid use disorder treatment space and the intersections with oral health. Because as it shouldn't surprise anyone on this feed, your teeth live inside your head, which is part of your body, and opioid use disorder is an addiction, and it's a brain-based chronic recurring relapsing disease, right? For which there are medications and treatment modalities. So that's sort of my frame. I am the SOTA, so the State Opioid Treatment Authority, and when I say that, people are like, really? Soda? And they think about like a can of Coke or Pepsi. And I'm like, oh, it sounds the same, but it's a little different. Um, and in that role, I oversee um, the opioid use disorder treatment system across the state. And so that means all of the opioid treatment programs that are clinics that are certified by SAMHSA and the Drug Enforcement Agency and Department of Health Services, and then myself, and they're accredited by a national accrediting body. They can prescribe methadone and buprenorphine and naltrexone for the treatment of opioid use disorder. And I also, as part of the opioid use disorder treatment system across the state, includes healthcare providers who can prescribe buprenorphine or naltrexone to treat a substance use disorder, which opens up the opportunity for folks to receive treatment for substance use disorder at whatever provider they're seeing. They don't have to go to a specific clinic. And that really opens up the scope of how we can begin to meet communities and people where they are. And I think that one of the most powerful ways to treat anyone, right, is from a whole person first standpoint. And through that lens, as many services that we can integrate into one place so that when we engage with someone and they need oral health care, preventive health care, vaccines, behavioral health, and potentially treatment for substance use disorder, whether that's alcohol or opioids or cannabis or nicotine or anything else, that we should be able to address all of the needs of that person, or as many of them, right, in the same clinic. So from an integrated standpoint, I think we have the best chance of treating the whole person. So I think it's really great. I see that the NOAA emblem on your lab coat. But I know that dental hygiene and oral health is integral to physical health, and it's integral to behavioral health, and it's integral to people being able to feel like they can do life, right? Because you can't
That's
do life if you don't have teeth. It's hard to eat. Can't do life if your mouth hurts because your mouth hurts, and that's where your focus is. Um,
yeah, that's
yeah.
really true. We did do a little bit of a engagement with some of the uh, uh, dental providers and behavioral health management here at some of the community health centers to talk about the opioid drugs that are used, like Suboxone and so forth, and how they cause cavities. So just a little plug. If
we did get an English and a Spanish form that we can share with anybody that talks about how to take care of your teeth after you've taken your medication, like Suboxone or bupropion and all that stuff. So please reach out to me or the coalition, and we can get people set up. So I really thank you so much, Kate, for what you do. I remember when I met you, you were really into helping pregnant women on substance abuse, and that just touched my heart so much. And when I saw you win this award, I was like, yeah, that went to the right woman, because you have the passion what you do, like I have the passion about teeth. So it's really great. So
Thank
thank
you.
you.
Thank you,
So
Tammy. Yeah, I should say that the other, another hat, not the other, because I wear a lot of hats, but another hat that I wear is as the Women's Services Network Coordinator for the state, which specifically means coordinating at the system of care level, resources and programs and systems that meet women across the age spectrum who are struggling with substance use disorder. And so in that frame, the priority population, just like within opioid use disorder, the priority population is pregnant and parenting women, whether they're teenage moms or middle-aged moms or whoever, but pregnant and parenting, because similarly to oral health and preventive oral health, right? We have the very best chance of improving the health of two generations of people if we are intentional about addressing preventive care and managing chronic conditions, whatever they might be, ideally before a woman gets pregnant, but certainly while she is pregnant, so that we can have her engaged in treatment, stable and healthy, and she can have a healthy pregnancy, healthy delivery, and the baby has the best chance of having a healthy start at life. And so that same focus that I brought to when you and I first met, I continue to stay in that space and really working to make sure that we're doing what we need to do as a system to reach our pregnant moms with what they need so that they're as healthy as they can be.
true. That is so true. So before we go, I'm going to say congratulations again, and I'm going to start with the questions about the award and so forth. So what were your thoughts about receiving this award? How did you feel when you got it? Because you're like, wow, I got the Academy. Thank you.
Like, what? I am not a healthcare provider. Humbled and happy and surprised when I was notified that the team wanted to nominate me, but more so that this nomination didn't come from the Access team. It came from folks external to Access who said, we really need to recognize the work that Kate is doing. And that means a lot to me. I am very passionate. I live and breathe the work that I do, and I want my work to matter, and I want my work to change the way life is for people. And if folks in the community are recognizing that that's the impact my work is having, that's everything. Yeah, I was really very happy and surprised and um, honored to receive this award.
It went to a good person, so you didn't have to be a
Thank
provider
you.
because you're providing knowledge and so forth. So, do you believe that additional efforts are necessary to draw greater attention to this cause that you have, with the opioid addiction and so forth? Is there enough attention, or do we need to go further and take
I
it
think
deeper?
not seeing we are seeing a reduction in people that are dying from fatal overdose. That's good. We see that nationally, we see that in the state, but we're not seeing a reduction in the numbers of people that have an opioid use disorder. We're continuing to see more and more people have their initial diagnosis reflected on claims. We continue to see significant groups of people each year who have not been in treatment previously and now they're ready to be in treatment. That number continues to grow. I So from a need standpoint, we continue to see more and more people who need treatment, or who are requesting treatment, right? We don't really know how many people have an opioid use disorder until they present for treatment one way or another. Um, and we know that there is a significant amount of stigma and bias about addiction, about drug use, about particularly about women who are pregnant and may have a substance use disorder, or have young children or a baby and have a substance use disorder, or are in treatment for substance use disorder. Um, there's a significant amount of provider hesitancy to treat, particularly pregnant women or breastfeeding women, because there's a level of fear. We don't want to do any harm, don't want to harm the baby, don't want to harm mom. And there is so much that has changed in the field around best practice for opioid use disorder treatment, that folks that healthcare providers that have been in the field for 5 years didn't have this information in their training or their residency. I mean, they're not well equipped, right, to have all of the information and all of the support that they need to feel comfortable and competent in treating. So I'm going to say yes, there is more to be done. There's also more to be done, both on the what is addiction, what is opioid use disorder, how do we understand what the best practices are for treatment, what works, what's safe, what's not. All of those aspects of this disorder do need more awareness and more training, really cross-sector. And I would argue that all of the physician types that are able to prescribe class 2 medications, right? Includes
Yep.
buprenorphine. All of those providers need to be more well prepared to recognize when a substance use disorder may be a concern and have enough confidence to do that screening and brief intervention conversation, and then feel confident in the ability to treat, or know where else who can I partner with, who can I leverage in co-treating this patient so that we can give them the resources they need. Absolutely, there is more work to be done in this space.
I agree. All that stuff is just like when I look at dentistry and special needs and so forth. Yeah, the more we train providers, the more we'll be able to treat the special needs people. But and something like this too is the more people that do give the medications out, just understanding that hey, this is what's going to be the positive out of it, as opposed to what could be the negative. Instead of looking at the negative, that would be so what drives you to continue advocating for this issue? Is there something in your past, or is there something that you went through that makes you feel like you? Because I know in dentistry, I had the worst teeth, and I was the biggest fear, so that's why I went for dentistry. But
yeah. So when we think about the reasons, when we think about addiction can be addiction is a collection of behaviors that somebody engages in, even though they know that the outcomes are going to be bad, the negative consequences, but they're compelled to engage in the behavior, use the substance, drink the alcohol, whatever it might be. So it could be gambling, could be shopping, could be drinking, smoking, whatever it might be. It's not any one thing, but it's that reward pathway that's gotten hijacked right in your brain. And so you're doing the thing that makes you feel good because that's what humans do. That's how we're built. So when we think about, so what is it? Like, this is where adverse childhood experiences and what happened to you matters so much more than what did you do. right? So it's that shift from you've made a bunch of bad decisions and you are deserving of punishment, shifting from that lens to what happened in your life before you can remember that created this set of patterns of coping and patterns of understanding how the world works and what's normal and what should I do and how do I feel better. How did you learn that? What happened to you that created the you that you are today, right? Because everything that happens in our past helps build the foundation of where we are today. And so my degree is in early childhood and family studies and understanding infant brain development and infant toddler mental health, which really gets into that relationship between a mom and a baby, right? That's the first relationship that any human has is with their mother. And understanding how important that relationship is biologically, social emotionally, all of it, and understanding what can disrupt that relationship, that maternal infant relationship, what can change it, what can make it stressful, what can make it strong, like what are the factors? And really thinking back into epigenetics and what happened to that mom and what happened in her family and what happened in her community, those connections across generations are fascinating to me, right? The science of it is fascinating, of epigenetics and adverse childhood experiences and trauma and so how all of it fits together. Um, and then, yeah, it's understanding my own life, right?
Yeah.
What are the things that my family lived through? What were the stories and the experiences of my grandparents, my great-grandparents on, my mom's side, my dad's side? What's been the experience with alcoholism, with addiction, with mental health, with behavior? Like, what has been that experience in my family? Because understanding those genetic components, right? These are
Yeah.
heritable
Yeah. True.
brain patterns, right?
Mhm.
And tendencies. There's always this mix of what is genetic and what is nature and nurture and what. So understanding how all that fits together in my own life and then looking at my own experiences to put all of that sort of in perspective, when we get to have kids and then we're like late 40s, 50s, whatever, we're like, how do we make sense of who we are and how we are and how are we raising our kids and what's important and what's not important and how do we see what's going on in our world right now and why do we see it differently than other people? Because our lenses are informed by what happened before us. And that all of those relationships are really fascinating to me, just how it all works together. And also validating of what my experience in my own life has been and understanding, okay, this is why I think and feel and operate in this way. This is why I gravitate toward these kinds of relationships. This is why understanding myself,
Yeah.
and then being able to use that understanding to um, to make our system, right, meet people where they are with what people need, not with what
What
the
we think they
curriculum.
need. Yeah.
Well, it's not about what right? And it's not about what the curriculum says. It's not about what the model says. It's about, well, what are the resources in their community? What have they experienced? What do they not have access to? How can we begin to meet those needs with the people they know and trust already, rather than plunking in someone new? Um, and really that underlying frame of meeting people or communities or systems where they are, right? Rather than where I think they need to be, but where are they? How do I meet them there with what they need not what I think they need, but what they need in ways that feel like help to them. Not because I think it's what they need and this is what will help you, but because of what that person, that community, that system needs in the moment where they are. And I think the more as a system we can do that for people, people will be better. And
That's true.
that's what keeps, right?
Yeah,
Regardless of the setting, whether we're talking about dental fear or we're talking about medical fear, whatever we're talking about,
everything.
meeting people where they are with what they need in ways that feel like help, rather than I'm going to tell you everything you're doing wrong, or I'm going to tell you all the things that you did bad in your life. I'm going to tell you all the things you have to do over there. Like that doesn't change behavior. That makes people feel shame and feel guilt and feel bad. And that is not what we want. What we want is health. And to do that, we got to support people where they are to get where they want to go. Because again, their goals and what they want are theirs. They're not mine.
Yeah,
So
instead of trying to, yeah, not
those,
everybody fits in those books, Like there's people on the outside of those
that's right.
books.
That's right.
Yeah.
That's
Yeah.
right.
So that's, just, being from New Mexico, I've seen a lot of like the addiction issues and stuff in my own family, not my immediate family, but with cousins and so forth, and that have died
Yep.
and so forth. And to me, it's like, well, what happened? There was something why does
Right.
my family know all of this? And why did some of my cousins have to go through this? And I'm like, there's something in their background that happened because we don't live with them 24/7. They're just part of our blood, So I do see that, we use motivational interviewing in dentistry and understanding where somebody is, and just stuff as being a hygiene ambassador that I am, is like we're trying to get hygienists that are more look like the community as opposed to the norm of
That's
hygienists.
right. That's right.
So that's what you do. You try to do it so the provider looks like the individual, or the person talking to them has had lived experiences like that. So so what we
Yes.
already talked about your obstacles. So because there's a ton of obstacles, and what we may face in this beautiful bill, but we won't go that way. Um, are there any other things you would want or need from, like, what is there anything like people that are listening to this or the coalition can bring to help bring awareness to your cause? Is there things that, what we can do to talk more about opioids so it's not such a stigma?
Yeah, absolutely. So I think the more that we can make sure that people across the state and across sectors, right, whether we're healthcare, law enforcement, childcare, where whoever, that people understand what harm reduction is. So what naloxone is, how to use it, where to get it, when to use it. Um, to and to make sure that the people in their lives who may be at risk have it, right? So it should not be, so there's still a lot of fear and a lot of stigma around naloxone, which we know is Narcan mostly. There's lots of brands, but that's what most people know. We have a Good Samaritan law in Arizona, so anyone can administer Narcan to anyone um, if they think that person might be having an overdose. They're not going to get in trouble, right? Um, so that's the first thing is we really need people to understand better what naloxone is, how does it work, how do you administer it, and that it's not hard, doesn't take a lot of training. That's the first thing. Um, and I think the more people and places that we have that messaging that Narcan works, you can save a life, like all of those kinds of messaging, there's lots of it out there. So I, folks who are listening and dental clinics that are listening, hygienists that are listening, the more you can incorporate just awareness of substance use disorder affects more than 2.5 million people in the United States. It is
That's a lot.
incredibly common. Arizona has one of the highest rates in the nation. So this isn't something we can really ignore and say this doesn't happen to us in our community. It's not here, because it is here. So that's the first thing is if we ignore it, then people are going to die because
Yeah, true.
that's the risk with fentanyl. And then secondly is to really become educated about understanding where naloxone is, how to get it in your community. If you are a healthcare clinic, you can get naloxone for free from the Arizona Department of Health Services, and you can dispense it. You can give it out for free to people who need it. And I think creating access for the public to naloxone and advertising that you have it. So it's not behind the counter, behind a locked door. It's your gravity fed dispenser machine or wherever by the bathroom that's accessible. I think those are really powerful ways to reinforce that this is an epidemic. We're aware of it. We're not pretending it doesn't exist. And here's the tools we have to keep people alive. And then always following that with, let me connect you in. Here are the resources available for you. You're not in this alone, right? Particularly in FQHCs or other community health clinic spaces, you're primed already to address that whole person need and their behavioral health needs and any other co-occurring anxiety, depression, any of the other mental health concerns that may be driving their need to self-medicate, right? Maybe if you can address the anxiety, maybe it'll be easier for them to manage the substance use disorder treatment and recovery. But you gotta unearth what else is going on. What are you trying to self-medicate? Why do you feel bad? Is there something else that we need to manage so that we can help you manage recovery from this addiction? And integrated clinics are well positioned to do that already. That's what you do.
Do you know if there's any of the community health centers that are carrying the Narcan in their clinics, or is
that
it just
have Narcan? Yeah, there are several. So,
yeah? So I think
FQHCs,
all the rest has to probably jump on board with it. It
correct,
needs to be brought into all the clinics.
correct. And
Yeah.
I think that the more we can message out to, particularly to clinics that are community facing and see a lot of people, right? That we need to really reinforce the availability of naloxone, the safety of it. You're not going to hurt someone if they're not having an overdose. You're not going to hurt them if you give them Narcan. And really understanding, what does an overdose look like? How do you give naloxone? What do you do next? What are the steps? Always call 911. We have to stabilize them. And to understand what naloxone won't work on, like xylazine, like the other contaminants that are in the drug supply. So, it's a scary world out there right now. And I think the more places that are already community facing and have folks there already, those are the places that we need to have naloxone available. We need to have linkages to care available so that, my friend needs blah, blah, blah. Well, here's some information for your friend. Those are really important connection points. And I think that there's room to create more of them. And I think that there's room and opportunity for coalitions like this one to work closely with opioid settlement fund planning folks in counties across the state. Right? So there are funds that rest with the county from the National Opioid Settlements, right? That are in counties and cities across the state who are engaged in meeting the needs in their community. And so this the coalition at a statewide level and then in counties across the state, that's an important partnership, right?
Yeah.
Because between the two of you, you can reach a different provider set, right?
Yeah.
Dentists are largely not thought of as providing behavioral health or in the behavioral health space, and they're not really thought of as doctors. You just sort of, we talk like right here, carved out, right? Here's the dentist.
Yeah, I don't understand.
But you can prescribe, a dentist can prescribe and does prescribe opioids for pain, right?
Yeah.
And you can then prescribe buprenorphine as treatment for an opioid use disorder. Like that's within the scope of the license. And so from the standpoint of making sure that dentists and everyone in the state that has the appropriate licensure with their board to prescribe opioids, understanding that they can also prescribe buprenorphine and naltrexone, and being sure that they have access to that training, and then knowing what that certification on their DEA card, what that means
Yeah.
that they can be a source of, let me initiate you onto buprenorphine because I can write this script right now, and I'm going to connect you to a provider who specializes in addiction medicine. But a dentist can do that.
Yeah,
And
it would probably more be in like a community health center because I know that the electronic record systems are more are
they're
connected, so we can
connected.
see it. We can see if somebody has it in private practice. That might be something that would be more
They may not.
difficult, and
They may
they
not.
don't. Yeah, but a lot of times, and they don't really ask as much of the medical history, like we
That's
here
right.
because we take blood pressure and everything. So
Because you take blood
this
pressure
may
too.
be yeah, this may be something to educate some of the private practice dentists on in the future.
Absolutely.
Like, how can we bring it up to them so they understand,
Absolutely.
especially the ones that live in the areas where
In rural areas where
rural areas.
they're
Yeah,
doing they're doing the fluoride varnish and the preventive with the kids, and they're seeing the adolescents who are out experimenting because we know that's what they do, and they're seeing the parents and the grandparents because they're family practice dentists, right? I mean,
yeah, yeah,
and they're doing the extractions and they're doing the wisdom well, you need to know, like, be aware enough of what this looks like so
right.
that you can feel like you can be that first step to get them connected to the behavioral health clinic or um their primary care, whoever that might be.
Anybody that can help them with their situation, which and it's all about resources. So you talked a lot about like um, getting the free medical stuff, for the FQHCs. I just need a link from you. You can put it in an email, and I'll add it to the paper. And then the national opioid settlement money. That's something really nice to hear about because of stuff funding that might be cut from some of the FQHCs. Maybe they can get some of that money. Also, I just want to know if there's any other accomplishments you've had that you would like for us to talk about, in your life, whether, hey man, I ran a marathon or, anything like that. I never did.
Well, I many of the folks in the coalition know Jacob, who's know that I have two kids. So Jacob is my son. He just graduated from high school in Blue Ridge.
Woo-hoo.
And Madison's going into sixth grade, so starting middle school. Um, so I'm in Green Valley in Southern Arizona now. Of chickens and gardens, and I'm looking at sunflowers that are like, 8 feet tall. And so
Oh, man.
I've been a busy girl.
It is. I mean, just your children and the accomplishments of your children, and your 6-year-old. I'll tell you. I mean, your sixth grader. I'll tell you one thing. Get on her for blood brushing because I see that they don't do it when they're in that grade for whatever
Oh,
reason.
she is because she's doing Invisaligns. So
Good for
she's like
her.
on it. Yep, on it.
That's
So
great.
so yeah. So things are good. I mean, I have I have a collection of awards and recognitions. Yeah, really, the fact that I can look out my office window and see a raised bed full of blooming mint with bees on it, and watch little families of quail running around on the ground. That's a pretty cool thing right now.
That's a
So,
very great accomplishment because, there's not any AI that can clean people's teeth, so I have to be in the clinic. So, but thank you for pretty much taking the time to talk to me today. And, I really appreciate everything you do with the opioids. And I mean, people see what you do, and it's such a need in our community that without people like you, we'd probably be a lot more people dying. So, pat yourself on the shoulder because you probably, with your advocacy and your talking, not your mouth, but your talking, you have probably saved some lives. So, on
thank
that,
you.
I respect you 100%.
Thank you, Tammy.
You're welcome.